Thank you. So good evening, everybody, because I believe for everyone except for me, it is evening, and welcome to this meeting that is on M&E tools training. I will share my screen so that we can move together. Okay, there we go. So our training today is on monitoring and evaluation tools, and this is the first part of the training because we shall be coming to it a little bit later on based on the feedback that we get from this session. So what we are doing today is just basically targeted for the M&E liaisons, but I think that it is important that everybody in an organization understands the tools that are being used. Then we hope that if you're attending as the M&E and you're just the M&E person alone, then that you would be able to also train the other members in your team about the use of these tools. And also I want to say that I know that their tools are not new to you guys. You have used them, but the reason why we are looking at them today is that these are the most important tools for Girls Inspire to be able to monitor what is going on within a project. And that these tools are, we have found that sometimes they are not necessarily used to give the information that would help us to understand that impact. And so the organization may use a tool, but are they using this tool later on to assess what they have actually done? Or is it being done just for reporting purposes? So we want to go into that space where we are seeing as organizations that these are the tools that are important, but also seeing how they can be used within the organization to be able to understand the difference that you are making. So welcome once again, and thank you very much. So I'll go directly into the agenda. Let me just put this on screen. So welcome and greetings to you all. Maybe those of you who are here, you can just greet us, greet each other. Let's start with Bo. Maba, are you there? Okay, Maba, you're muted. I don't know whether we can't hear you because you're muted or because you have left temporarily. John, would you like to say hello?
Okay, maybe before Karen, Dr.
Yes,
Karen.
yes,
Sorry.
Salim.
Before John, because John is from Yapo.
Yes.
He's new and he will be joining us on the monitoring and evaluation. So that's why he has managed to attend this evening. So okay. We're here together.
Okay,
thank you.
Thank you. Thank you, Salim. So I suppose you have both greeted us and John has greeted us. But John, say hello. Just say hello.
Hi, everyone.
Welcome, John. Welcome to the team that is working with us in Girls Inspire. Welcome so much. This is a place where you will enjoy being with everyone because of the learnings. Wendy?
Hello, everyone. I'm Wendy from Kenya. I'm happy to be here.
Thank you. Thank you very much, Wendy. Maba, you want to greet us?
Hello, Karen. Good evening, colleagues from Botswana, and good morning, dear Karen. Actually, when you called me to say hello to the team, I was still talking to Dandani. I think she had logged into the wrong link, but she'll be joining shortly. But otherwise, greetings from Botswana.
Thank you, thank you. Yes, I can see Tendani is joining. So thank you very much. So Botswana is represented, Plavio is not represented. YAPO is represented and REAP is represented. So there are 3 organizations. We should be 5 organizations. And that is perhaps the first thing that I want to talk about. But first of all, let me talk about the feedback on the response from the previous session. And one of the things that we had was very good response this time to the feedback from the previous session. And I would encourage you, although we may be few, after the session, once we send you the recording and we send you the link to the feedback, kindly fill it out. And so the first question was, how was the session helpful? These answers I have sort of like synthesized from what people have said, because if I find common answers, then we just synthesize them and put them together. So first of all, how was the session helpful? And people said that they appreciated sharing of the work and seeing what has worked for others. And I think that was the main import of the session, to be able to see that you're doing good work and that there are also other people doing good work, and also give you ideas of what is making a difference in other programs and projects. Then what new thing did you learn? One of the participants said that Scale Up is about creating impact and not numbers alone. And I really like that feedback, because really that is what we were trying to put across in terms of scaling up. We are trying to talk about creating impact, not just having more and more and more women and girls. And at the beginning of this particular implementation year, there were partners that wanted to expand into new areas. And I told them, no, you're not going to expand into new areas. You're going to go back into the areas that you have already been working on and see what you did and how can you bring it out in order to ensure that you are impacting on the same people and making a difference in their lives. And so that was really good feedback about creating impact. Then we also, one of the participants also said different ways in which partners can use the same results-based framework to tailor activities to their context, because you saw that different partners really brought out different issues in terms of what you were discussing. Then what did you hope would be discussed or was done but was not? Some of the feedback was about more detailed case studies, that we need to have more time for discussions, and that is always very true. And we always have to juggle between how much time do we actually use versus what is supposed to be done. There was 1 or 2 comments about how do we collaborate with government, and that is an area where I believe that we have one of the partners, the partners from India. They are collaborating very closely with government right from the beginning of their project. And we are going to perhaps ask Nivi, she's not here today. We are going to ask Nivi to try and explain to us that process and how they're doing that. And I think it will be a good learning for all of us. Then we also wanted an in-depth feedback on the challenges that are being faced. And I believe that is important, that we need to have a session where we're just looking at what are the challenges that we are facing and how can we help each other to overcome these challenges. So perhaps we can arrange in the next meeting for an open round table where we are just discussing what are our challenges and how are we dealing with them. And then it was recommended that we have more training on needs assessment and that we have monthly meetings. Now, I would love to have monthly meetings. Let's see how it will go. We had put them into bi-monthly meetings because of the pressure of work on the partners and on the pressure of work on us when we are having the monthly meetings. But that is something that we can agree on and see how it would go. That was the feedback that you gave us. And I want to thank you so much because it was very useful feedback for us. I also want to touch a little before we go into on what we are doing, the planning updates for 2024 and 2025. And this planning that we are doing for 2024, 2025 looks a bit different this year. A team from BOW has not yet had the team, what the other teams are doing, because we have changed the results-based framework we are focusing a lot more on LTO1, which is work with governments, and LTO2, which is work in institutions. And we are trying to move away from LTO3, which is the work that is purely at community and participant level. And so even the work that we do at community and participant level, we are trying to link it to institutions, and we are trying to link it to government. Like, for example, at Botswana Open University, Maba, you guys are already doing that because you're already an institution and you're working with the women and girls in the community. And what you're trying to do is to bring them onto the online space, the ODL space. And so that you are already doing. And that is where a lot of our partners are going to be moving into within this coming implementation year. So the planning that is going on for this year, Maba, you want to say something? Sorry, I wasn't looking at the screen.
No, I was actually appreciating your comment. Thank
Thank you. Thank you. Yes. So the partners that are not yet working in institutions and or with government, we are trying to move them towards that. And so the planning process may take a little bit longer for others, may take a little bit shorter for some. I know like REAP, for example, already works a lot with the government. And so for REAP, Wendy, for you guys, it is a little bit easier. That transition may have been a little bit easier than for some of the other partners. Two things that you will realize today. One of them is that Bavoshia is not here. Bavoshia is on leave. And so I know that will have an impact on some of the payments that are being done. I believe that she had tried to complete as many of them as she could have done before she left for leave, but maybe there is something still pending. But I know that anything that was sent before Friday, Bavoshia just literally worked 24 hours to try and look through all the receipts and all the deliverables and try and ensure that everything was in place. So I'm hoping that no one is inconvenienced. What we had hoped for was that by the time she was going on leave, that we have the draft contribution agreements, but no matter, we shall still press on. Another thing you may notice is that we are really few. We are fewer this time, and that is because in this implementation year now, what we are coming to 2024, 2025, there is a lot of reduction in funding. And so therefore, we have had to prioritize which are the partners that are going to be able to help us to get to where we are trying to move in terms of working with governments and working with institutions. So we have looked at the programs that partners are doing. And unfortunately, we have had to sort of exit some of the partners and put them on hold for this start of the planning until we can get more funds. So I'm hoping that in the months to come, if more funds are available, we'll be able to bring back on board the partners that we have had to say, just wait a minute, and then we shall all be able to move together. So it's critical that we move fast. It's critical that we move quickly. I know that there has been that issue of reduced funding, and it's maybe a little bit difficult to plan. But thank you, Wendy, Jacob, Salim. You have handed me in your drafts, and I will be getting back to you with them as soon as I can. Thank you. Now, I will come back to the training on commerce and financial literacy manuals a little bit. Let's go into the program monitoring tools. But before I do that, I'd like to pause and ask for any feedback that anyone may have. We are good?
Yes, we are good, Karen. Thank you for the nice introduction.
We are good. Thank you.
Okay, thank you so much. Thank you so much. So what we are looking at today is program monitoring tools, and trying to look at a range of tools that we are already, as I said, we already know about these tools, but we just want to focus on them because they are the critical tools that are used within the Girls Inspire initiative. And before we go into that, I'd just like to ask you, when we talk about monitoring, why do we think it is important? Why is it important for you as an organization, for you as an institution, to do monitoring?
let me go first.
Yes,
I
Wendy.
feel that monitoring is important because it helps you assess if whatever you're trying to achieve, if you're achieving it or if you need to change strategy. So
Okay.
it helps you realize it, or if you are maybe achieving it too fast, or maybe if there are challenges that are coming up that you didn't foresee at the beginning of the project. Yeah.
Okay. Thank you, Wendy. Thank you. Any other contribution why monitoring is important? Okay, thank you. So when we are talking about monitoring, and we are referring to looking at everything that is being done within a project, whether it is the resources that you have, the funds, or the human being, or the human resources, whether it is equipment, whether it is whatever it is that is used to implement a project or a program, then you're also looking at your activities and your results, and you're trying to see, okay, we have these results that are coming in, we have this information that is coming in. How are we using it to guide program implementation? And I like the way that Wendy has put it, because it basically summarizes what the importance of monitoring is. We're saying that, is our project on track? Are we really achieving it at the correct pace? Are we moving too fast? Are we moving too slow? Are we going to be able to therefore meet our goals or our deliverables? And she has also mentioned something that is very important. It also helps us to look at the challenges that we are facing, so that when these challenges are coming up, they are immediately noticed, they are immediately seen, and then a course of correction can be put in. So monitoring basically helps us to look at what is it that we had baselined in terms of people's information, where people are in our project. Where have they got training needs? We have done a needs assessment, or we have done a baseline, and we are able to move them through with them and see what change is taking place. And at the end of it, we will have clear documentation of our evidence of whether we met certain deliverables, or whether we did not meet them, and what are the challenges. There is this famous saying that if you do not know where you are going, then any road will take you there. You may have heard this, that if you really don't know where you're going, then it really doesn't matter what you do. But because in a project, or because in a program, we know where we want to end up, then we make sure that the road that we are taking, and this road is the monitoring, that road is actually going to get us to where we have wanted to go in terms of what we had promised our participants we are going to deliver. So monitoring helps us to be able to do this. So the tools that we are using in the Girls Inspire, they're different tools. And one of them is what we call the KAP survey. And the KAP survey is simply a tool that is used to explore people's knowledge, attitudes, and practice. Sometimes we call practice behavior. So when I know something, I have a positive attitude or a negative attitude towards it, I am able therefore to act or to behave in a certain way. If I constantly act or behave in a certain way, then that becomes a habit or a practice. And so the KAP survey is used to find out, what do people normally do? What do people know? How do people believe? And so it is very useful at the baseline, because then it helps us to feed into the design of an intervention. What do I mean? If I am having a group of participants that I want to train in human rights, for example, and I do a KAP survey in the community, and I find out that this community has absolutely no knowledge about human rights, the way in which I will speak with them is going to be different from the participants that maybe I surveyed and found out that they have this knowledge. So therefore, KAP helps us to have a baseline, and we can use this baseline to feed into the way we do our interventions. And the KAP survey also helps us to evaluate the impact of interventions when we see change. If people have changed in knowledge, if people have changed in attitudes, if people have changed in behavior, then we can say that our program is making a difference. Now, I want to also say that the KAP survey is a broad terminology. because KAP survey can be used in different forms. And this KAP survey, usually the way we are using it in Girls Inspire at the baseline, excuse me, the way we are using it at the baseline is that we normally have two types of questions. One of these is what we call the Likert scale questions, and they are quantitative. So when we are talking about quantitative questions, you're asking us, do you know this? And somebody says yes, no. Do you go to school? Somebody says yes, no. That is a quantitative type of question. When we ask somebody, have you heard about the Convention on Prevention of Violence Against Women? That kind of Likert type of question then helps you to understand what is it that people actually know. We ask Likert type questions that are for attitudes to also find out, what do they believe? Do you believe that women should be leaders? Yes, maybe, no, or don't know. That is a quantitative type of question. But we also have KAPs with open-ended questions. And we use these open-ended questions. For example, at the end of this, this recording, when we send it to you and we say, can you tell us what was helpful, what was not helpful? Those are open-ended questions that help us to understand what did people understand about the training? Was it effective? Did they learn anything new? Is there anything that we need to change? Now, when we ask questions before, that is before we do any training, these are usually combined with the training needs and preferences survey for participants. When we are looking at evaluation or assessment before we start a training, we usually want to find out what are people's expectations. It can be done by simply you're having a session where people are already present and they're raising their hands to say what their expectations are for a meeting. Or it can be done as a pre-workshop or pre-training questionnaire where you ask, when you're coming for this training on human rights, what are your expectations? What would you like to learn? And so people come with those expectations and hoping that they will be met through the training. KAP is very important for us in all our tools is to disaggregate data so that you are able to understand what are the patterns among males, what are the patterns among females, what position do males take or what position do females have about a particular issue. Is it the same? Is it different? And to these differences, what do they mean for us? So one of the let me look at just two sample surveys and then I'll pause for a second for any feedback on this. Two of the surveys that we use in Girls Inspire. Number one, which is quantitative, is the household survey. It is largely quantitative. There is a section that is qualitative, but it is largely quantitative. Now, this survey collects information on access and control over resources, knowledge of human rights, and sustainable farming practices. So as I've said, in the whole, it is mostly quantitative. And you have all used this household survey, which is a type of a KAP, because it assumes that thereafter you're going to go back into that community, you're going to get women and girls who are participating in training, and you're going to be able to train them. Now, what is critical in this household survey is that you as an organization need to go back into the household survey once you have done your training and use some of those questions to find out, did we make any difference or did we not make any difference with our training? The second one is the focus group discussion that we do with women from the target community groups. A focus group discussion is also a KAP because it's collecting information on knowledge of gender discrimination, gender-based violence, attitudes and practices towards local actions against rights violations, and actions in promoting the education of girls and women. And so it is qualitative because it is a focus group discussion. So, excuse me, these two sample KAPs are used within Girls Inspire at the start of a project. And when we are talking about the start of the project, it helps us to baseline so that the next time we come around, in order to understand what difference that we have made, we need to refer to these sample KAPs. So let me just pause here and see whether there is any feedback from the group. Yes, Mab. Oh, I thought you had raised your hand. Any question or feedback before we go on? Okay, silence is assumed.
Can I come through?
Yes, Tendani.
I can't see my hand. Thank you.
Okay, I can see.
I wanted to follow on this one to say, when we do household surveys and these, as we collect data, when we do the post or survey following the intervention, are we going to be following the same households, or we just do just a random sampling as well to see if we have impacted anybody else that we would come across to administer the survey on?
What do the rest think? Should we go back to the same households, or should we randomly sample again? If we have done intervention in a community, should we randomly sample, or should we go back to the households that we targeted in the baseline, sorry? Today's group is very quiet. Yes, Maba.
I would like to believe that maybe you need to go back to the same group, because you want to see whether that which you did during the survey and the group discussions have had an impact. Because from my understanding, intervention is about bringing a positive impact, or whether you want to see whether your intervention has helped. If it had not helped, you re-strategize on how best you can move forward. So my take is that you use the same group. Thank you.
Thank you. I think I would tend to agree with you. Wendy, let's hear what you say.
Okay, I also wanted to say that you target the same people, because the first information you got was from this household, and now you want to see if there was impact in whatever interventions you've done. Now you want to see the result of it, if there was actual change of attitude, or if now they have knowledge of whatever you wanted them to do, or if they're practicing what you have already taught them. So the same household. I'm feeling that's when you get the correct information.
Okay. Thank you. And one of the reasons why I also feel that we should go back to the same households is because that target area is where you have done the most intense work. But remember that when you do this, the baseline, when you use all the tools for the baseline, it means that in a household, for example, you are speaking to men and boys. And therefore, it is likely that if you're doing training of, for example, traditional leaders, or you're forming boys clubs, they will come from those households, because you already have that information from those households to be able then to get people to register into your program. So it is likely that your men, your boys, your women and girls will come from the same places or the same households that you did the first baseline. If you have a focus group discussion, for example, with women from the target community groups, and you're saying that we are targeting maybe 40 women for training in sustainable agriculture, most likely your group discussion will have had these women, and therefore it makes sense to then, you have registered them into the program, you know what they felt about certain things, you register them into the program, you train them in human rights, you train them in agriculture, you train them in entrepreneurship, and then you go back at the end of it and you're able to go back into the same survey data that you had at the beginning and see, okay, when we first had the first group discussion, when we were talking about human rights, when we are talking about support for women and girls' education, this is what the group thought. Now, do they think the same thing? At the end of the implementation year, we're going back and asking them the same questions and then see, is there a difference? And therefore, we can immediately know that because they didn't have this information at the beginning and now they have it, then it is our intervention as a program that has made the difference. So you're able to very clearly attribute the results to the intervention that you have done. And I think that is why it's critical to go back to the same household. Okay, great, thank you. So when we look at KAP surveys, remember I said that KAPs are basically like the overall or the main thing that we do. But if we look at then some of the surveys that we do, a pre and post training survey, you have invited a group of participants into a workshop. You have invited a group of women or of girls to do a certain training, or you're training male leaders. Now, when you are doing this, before you start your training, before you start your workshop, if it is with government officials, whoever it is you're at your training, it's important that you do a pre-workshop survey. If you have a group that is already organized, that is already known, this survey can be done in advance. It doesn't have to be done the day that you are starting to meet. But normally, because we may not have that access to that group, then we may not be able to do this survey. Or if people need an actual written, they need to write down what it is that you are surveying. It's not online. Then you would not be able to do it in advance. But if it is a survey that you can send out to people on WhatsApp or online and they're able to fill it, then it is a good thing, because the results of that survey help you to understand what it is that people know and what it is that they believe and what it is that they're practicing. So the pre and post training surveys, my idea of bringing them here is simply to emphasize that, please, kindly, before you do any training where you have a fixed group, we're not talking about community, because when you go out to talk to the community, that is sensitization, because you cannot control the size of the group, you cannot control who you're doing. But if you say that we are targeting to train 40 teachers on why it is important to avoid stigma for girls who are returning to school, then you know that these 40, you give them a pre-survey, you give them a post-survey, you're able to then gauge whether that workshop made a difference. The post-survey is the exact same survey that is given when the training has ended. The only difference is that it includes a section on how they're going to use their learning and what their overall experience was of the training. If you have filled out our training surveys afterwards, you normally see that for workshops, we ask, okay, what is it that you learned? How are you going to be able to use it? Will it make a difference in the work that you do? And then we also ask, how was the facilitator or the person who did the training? How was the venue? Because we want to be able to understand the whole expectation and how these expectations were met, but also whether participants were comfortable. And you may find that participants may say that the venue was okay, but it was very far. If you are dealing, for example, with women and girls in the community, and they say that it was difficult to come to the venue, and maybe you had invited 50 and only 30 turned up, then that gives you an idea that perhaps it was because the venue was far and people did not have the transport to come. That is why the others did not come. So pre and post training surveys give us a lot of information and data about the participants and about the training and about whether we are making any difference. So I have put here a sample of a policy review pre-workshop survey. The partners from East Africa filled this out when they were doing their policy reviews. And this is just a part of the survey. Pre-surveys are meant to get knowledge, to understand whether you have certain knowledge, but they're not meant to be examinations. I want to put that. They're not meant to be like, do you know how to write an indicator and then you, or do you expect, or sorry, you would not expect the participant to write for you an indicator. It would be to ask the participant, are you familiar with writing indicators? Do you know whether your organization has a gender policy? Do you know whether this is updated? So you're asking questions that are likely to yield answers, but they are not technical questions, which then the participant would be very intimidated about going through the workshop. So it is simply, do you know about it? Do you think it is something that we should have? Do you expect to be able to use it afterwards? Those are the kind of questions that we would ask. And then we also try to make the pre and post surveys quite short, because we want to simply only get the essence of what it is that is important and not to cover everything that the participants would be having. I have actually attended workshops where the pre-survey takes about an hour to fill. And by the time people are through, they're just writing anything. Someone's just writing no, or yes, because participants are not expecting that the first hour of that workshop is going to be spent on what they look at now as an examination. So it should be brief, but it should be covering all the main points. But then again, remember, not every participant to a workshop or to a training is going to be able to fill out the kind of scale that we have just put here. So there are certain imaginative ways of conducting evaluation for low literacy and for younger audiences. You're dealing with maybe a group of secondary school boys where you're trying to form a gender club. For them, sitting down and doing the kind of Likert scale that is this of don't know, yes, can be extremely confusing for them. You're going into a group where you have low literacy levels, or you have adult learners who are not going to be able to fill out this form. They don't have to do this kind of survey. You can also do it in different ways. For example, one is using a storyboard. And this works extremely well for younger audiences, where you have a small sheet of paper, and on the wall, maybe you have put a white piece of paper, and you have asked them, can you write what is your expectation for this workshop? Can you do you know about, for example, do you know about sustainable agricultural practices, or which sustainable agricultural practices do you know about? They can write it on that small sticky note and put it on the board. So you would have different questions on different boards, and they're able to use that storyboard. At the end of the training session, or at the end of the day, you're able to collect those. And then once the training session is done, you can ask them the same questions, and you are able to compare those before and after answers. So a storyboard is a really good way of doing a KAP very quickly and with a lot of fun. Even for adult learners, that is also a lot of fun. We can also use short survey on WhatsApp for participants who have access to internet, access to mobile phones. You can do the short survey on WhatsApp. Then we can also, participants can also have a small group discussion, 10 minutes, 15 minutes, so that one participant is reporting back on the main themes, and the facilitator takes notes as they are reporting. So you divide the group up maybe into groups of 5 or 6 and ask them these questions, and they discuss them. When they are reporting back verbally, because this is especially good for low literacy audiences, they are reporting back verbally. You as the facilitator are taking down the main points. Group 1 said this about the 5 questions that I asked. Group 2 said this. At the end of the training, you again put the same people into the same groups for the same discussion. And then you're able to note down from their responses, what difference did the training make? Great. Do we have any feedback from that? Okay, shall I move on?
All is well, thank you.
Thank you, Tendani. Now, this is the community scorecard is a tool that we use within CALL in order to be able to monitor specifically rights violations. Now, a community scorecard is not necessarily only used for rights violations. It is used in very many ways to help the community to assess what are the services and programs available in the community, whether we are talking about educational services, health services, water, roads. It doesn't matter what kind of service that is expected, electricity, internet connection, whatever kind of expectation that a community has in terms of development, and therefore what services and programs accompany that. It can be used for all of those. But for Girls Inspire, we specifically target using it for the, we specifically target using it for monitoring of rights violations. Now, when training is done on rights violations, it means that there is awareness in the community. There is awareness among women and girls. Many of your women and girls are already in, for example, the savings groups or the community groups. They have joined together, they have come together into various kinds of development groups. Now, it means that when we are saying that these women are looking out for each other in terms of monitoring their savings or monitoring their social welfare, once we train them in human rights, they can also start looking out for each other in terms of human rights violations. But they can do this knowing that you have trained them in what are the kinds of rights violations, what are the different kinds of legislations that are available in their communities or in the different countries, and where is it can they go to report. You're providing them with these kind of resources that they are able to use in order to be able to go out and report when rights violations are done. But then you conduct training. For example, maybe you conduct training in Q1. You may not be going back into that community until maybe Q2 for some other activity. What happens in the meantime? If the community or the groups of women can be empowered to identify the gaps in services, if they can be empowered to monitor community groups functioning and coordinate with the different agencies that you have trained about, then it means that the community itself is taking ownership of improving community responses, improving community services. And so the community scorecard is a template or a form that is built, and that is given to each of the communities in which you have done training. And you are able to identify specific people. It is not just left to anybody, but it is specific people. And the best kind of composition for a community scorecard is where you have somebody from local administration, you have somebody from, for example, a women's group or one of your female participants. You have somebody from the traditional leaders or the leaders in the community, whatever form they take. You have somebody who is from social welfare within that community. And you have a membership that is then different and eclectic, and not a very big membership, because when there are too many people in a group, then it becomes unwieldy. But we are talking about up to a maximum of 10 people, and they are able to meet regularly and be able to fill out the report card. But they also sensitize community members. Hey, look, if your rights are being violated, or if there is a service or a program that you feel that the government, that we need to talk to the government about, report it to us. If maybe you have reported a rights violation to the local area or to the chief, and the chief has done nothing about it, report it to us, and then we take up the matter. So this is a group that is completely empowered because of the training that they have received in trying to fill out the community scorecard and ensure that rights violations are being addressed. So it means that then the project or the program, like if, for example, if we are doing this in Tanzania, for example, Yapo, your team would be able to go back once in a while and say, okay, what is the progress in dealing with violations? Did anybody report? What was done about it? Is it in progress, or did it stall? Are we able to see how the community has been able to report progress? And it is also a tool to report back to the community and say, hey, look, you reported this violation against a certain person that was done because of, maybe, for example, gender-based violence. You reported this. Before the use of the scorecard, before the use of the training, when you reported, nothing was done. But now that you have reported, the chief has taken it up. Maybe it has gone to the local court, it has gone to the police, and something is being done. It is in process of being done. So the community report card is quite an important tool, is quite a useful tool for being able to do that kind of work. The next tool that we have is Stories of Change. And Stories of Change is a tool that I find that is becoming more and more important. Now, let us first look at the cartoon that is there. This cartoon is talking about, the man here is saying that we have an indicator that measures, he doesn't finish the sentence, but in between the man and the woman, you can see that there is a scale there probably, so we are saying we are measuring children's weight, children's height to determine whether this child is malnourished or whether this child is not. And so this person has come in with an indicator that puts children maybe in a percentile and says that if a child is underweight, are they in the right percentile for their growth chart? Are they in the wrong percentile? Are they malnourished and so on? And they expect a number. But the woman here who has, or the man, it's unclear, the person who has brought this child is saying, let me tell you a story. In other words, let me tell you about this child, because you may be weighing this child and maybe the child has come out of a period where they were really sick and now they have recovered. And so their weight may be lower, but it is not because they have always been underweight. It may be something that has been happening. And so a story of change tells us something beyond an indicator. In other words, it is done to understand what difference have we made. And as a story of change in Girls Inspire is carried out in a focus group discussion. You have a cohort that has attended a similar training. Doesn't matter what training that you're doing, whether it is focused on education, on entrepreneurship, on digital literacy, on forming savings groups, doesn't matter what it is, but you have been trained them as a similar group. Then they have had time for this change to be effected. Then you come and ask yourself, okay, so what difference that have we made? And we are measuring this impact over time on a personal level. What difference does it make to me? So looking back, you may ask, for example, looking back over the last month or the last year, what has been your most significant change in terms of, for example, the way in which you understand savings, or the way in which you understand value addition for fruits and vegetables? Participants discuss among themselves. So your focus group discussion has got maybe 7 to 10 people, and you give them time to say, what difference did our training make to you from your own point of view? It is a complete open discussion because everybody's change is different. And so they decide, after discussion, they decide which one of the stories that have been told by everybody that they want to discuss a little bit more about. So the story of change begins with a focus group discussion. People are simply saying their experiences about a certain training or about a certain sensitization that you have done. Then they decide on just one story. Then you have another focus group discussion with the same group of people, maybe 2 or 3 days later, usually not within the same day, because focus group discussion where we are sharing personal issues is not very easy, or not, I mean, it's a little bit difficult. Did I see a hand? Did anybody raise their hand? I don't know why I can't see the participants. Oh, there I am. No, nobody has raised a hand, but I thought I saw a hand. Okay, so, but then after we've done our stories of change, we go into what is called the most significant change. And the most significant change here is the second focus group discussion, where we are looking at all the stories that we have asked, and we selected one that is the most significant. So if you look again at the illustration, you have a group of people. There is a whole lot of papers here that are their different stories or their different understandings. Then we say that what is the most significant change that then we can understand? Because we ask the simple question, why? Why did you as a group decide on this story as the most important one? So it is important that when we are doing the focus group discussion on the stories of change, we are not asking questions why. As a group facilitator, what you're doing is that you are collecting these stories, you are understanding them. The only questions that you ask are for understanding. That maybe you said, maybe a participant says something and the rest of the group did not really understand it. And you ask, okay, can you maybe clarify what you said? But in the stories of change, we never ask the question why, because we cannot quantify the change in people's lives until they come to a position where they say that I shared a story, John shared a story, Jacob shared a story, but I think that it was John's story that was the most significant out of all the stories that we have shared about the same experience. So when you come now into the next focus group discussion, the main question here you'll be asking, why do you think this was for the most significant case or the most important issue? So those are stories of change, and they are done after quite a number of, a period of time has passed. So today what we have discussed is different tools that you can use for monitoring. And maybe what we would like to take a moment now is just to find out, do you have any questions?
Yeah, thank you so much, Karen.
Yes, Jacob.
For your presentation. I'm sorry that I came in late. I was running here and there. And I didn't introduce myself. My name is Alok Jacob. So about the presentation, the community that we serve, most likely administering some of the questions to them will be a little bit difficult. Like there are categories of people whereby you can't administer to them questions before they come to the training. For instance, let's say you're handling women in the village saving groups.
Yes.
There are more women who does not even have phones.
Yes.
And I feel it is difficult. But when handling teachers, like somebody said, it is okay. And then I think we only need to design our questionnaires to, earlier enough and send to them earlier, maybe a week before they come for the training. And then my question comes in, what about the post survey? Should it be given to them during maybe like on the last day of the training, or it should be sent to them after? Because if it is after, others may not even work on it. So yes. I want to understand that.
Yes. I think that that's a really critical question, and that is usually quite a problem. Wendy, did you want to respond?
I just wanted to say something. Or maybe just share an experience that we have had.
Great.
For different, okay, because we deal with different groups, just like Jacob had said, we target them with different methods. So specifically, like you've just told us, if you're targeting these with the FDG or the pre and post, I tend to feel what Jacob has just suggested, that you send a week earlier, I think you will make someone overthink. That is my thinking. I'm thinking someone will overthink it or may find a reason to lie. So to maybe get accuracy and where others are also present, I'm thinking if they can do it together. And then for the pre and post, I'm feeling in the same meeting to also avoid others not answering or participating in it. If you do it in the same meeting or on the last of the on the last day of whatever you have taught, I'm feeling you are in a better position to get better feedback.
Okay.
Yeah. My take. Yeah.
Okay. Thank you so much. And I think that here we have to, this is basically the nature of adult learning. Salim, I'll give you a chance to say, I don't know whether you wanted to say something. I'd rather get your feedback. Go ahead. Yes, go ahead.
Oh, thank you. Just to add something on top of that is that I'm speaking of our experience as well. Maybe during the training of parents. So instead of sending the questions before they have attended the training, it's a training room, the pre-taste is done at the training venue. So whenever they have sat themselves, then we distribute those assignments so that they can be asked some questions which are a little bit tricky, they just want to understand, the same as you mentioned, the CAP. It's just kind of a CAP survey, whether they have knowledge, they have attitude on that, or they are practicing it. So after the questions, then after the training, maybe the training takes 6 or 4 hours, maybe they go for a break, and then once they came back for another session or the final session, then we do the post survey in order to understand whether they have understood the training, whether they maybe they could have some knowledge about it, maybe because they do not know whether they have that ability to understand it. After the training, they came to the aha point where they say, okay, now I know this. That's the additional point to that. Thank you.
Thank you. Thank you very much, Salim. Thank you all for your feedback. I think that the critical issue here to understand is that every situation is different. Every organization is meeting different kinds of people. And so that is why I think it is important to know that there is not one way of doing it. When we talk about understanding what knowledge people have and before and what knowledge people have after, remember that even right from the baseline, when you're doing the household survey, the FGD groups with women, with men, traditional leaders, students in schools, you're getting information and knowledge. And if these same people come in for a training about some of the themes that you got in the household survey, you're able to then find out whether there is a change in their knowledge, their attitudes, their practices. But in a more formal setting, which is, I think, what we are referring to, you think about your audience and think, if I am able to send this survey a day or two in advance, and they are able to fill it, well and good, fine, I'll do that, and they will fill it, and they will come, and we can start. Then others, you will say, okay, let's take the time to do it. One of the things that we have found in some of the workshops, I'm sure you have attended, is that you have a survey at the beginning of the workshop, but there is no time actually given for the survey. So things are going on like introductions, expectations, or people are trying to find their seat, and you're being told, fill out this survey. It means that it makes the survey less of important. But if in a training agenda, you have, these are 15 minutes I need for the survey, and at that time, everybody is doing that survey, whether they are writing it on a piece of paper, whether we are doing it online, whether we are doing the group discussions, as we have just said, but you have given that specific time. Also at the end of the training, not that the training is, if the training is ending very late and everybody is trying to rush off to go to where they're supposed to be going, then it means that they will not really bother filling out that survey. And for many adults, just like the way we also do when we have this meeting, at the end of the meeting, we say, oh, please fill the feedback. But then we don't get that feedback. That is the nature of adults. We have so much in our lives that sometimes we don't take the time then to go back to that survey. You understand your audience, you understand what they'll be able to do or not be able to do, tailor your survey to that. But the mistakes that I think we make, especially in a very formal setting, is where we don't give time for people to do the pre-survey, or we sort of tag the post-survey right at the end of a whole lot of busy stuff that other people are doing, and they are wanting to get away. But if, for example, I'm having a workshop that is ending at 3 o'clock in an afternoon, I would rather do the post-survey an hour before, if I know that my audience is the kind that I may never get back. Like you said, for example, I'm training teachers, I'm training government officials. I may not have them with me. So I'll not have that space to remind them. I'd rather do it before we are having that break. But if there are people that you can follow up, then you can put it right at the end, just before they break off. So every situation is different. Thank you, Jacob, for your question. Now, I don't know whether there is another question or a comment on the presentations that we have had today on the tools. Okay, so one of the things that I want to say also is, in terms of these the tools, the household surveys that we have been doing, the KAPs that we have been doing at the beginning, as partners, maybe like Bo, this is the first time that you have done it, but some of the other partners have done baselines maybe twice or 3 times, and these baselines they generate a huge amount of data, a huge amount. So what we have done is that we have tried to get somebody to come in and try to analyze for us the data that we have had from 2021 all the way up to this implementation plan. Now, for some of us, our data is fuller than others. There are some surveys that may not have been done. Bo, I want to encourage you, please finalize the baseline so that it can be included in this analysis. So this consultant is going to come in and analyze all of the data and give us a picture of exactly what our baselines are telling us. And this will be useful to you then as partners, because when you say, am I making a difference in my community? Simply by asking some of those same questions from baseline, we can be able to see whether you're making a difference or not. So in the coming weeks, this consultant he's called Geoffrey Singini. He's from Malawi, and he may be contacting you in order to find out, especially the challenges that come with conducting the baseline. The tools, we have noticed that some of them, like the household survey, for example, personally, that is a tool I do not like because it is extremely long. And so we want to be able to see, can we revise these tools? Can we make them a little bit more friendly? What are the questions that we can bring in that should be there and are not? What are the questions that are in there and we can remove altogether? So kindly, as Mr. Singini, I will introduce him to you once we get the sampling plan going. I will introduce him to you and you'll be able to have some good conversations with him. All right, so sorry. I want to finally say that this hopefully is something that we are going to be able to continue, be able to do. I wanted to give an assignment because I am a teacher and I'm not sure whether I should. I'm hesitating actually. I think you'll notice I'm hesitating in my speaking because I'm not sure that I should give this assignment, but I think I'll go ahead to do it anyway. I would like, as we are doing our planning and as we are doing our thinking, kindly determine an issue that is critical in your target area that has to do with rights violations, that has to do with knowledge of human rights and the way in which they are reported. And after you have done sensitization, for those of you who are still continuing with the sensitization, whose implementation plans are still on, after you have done sensitization, try and think about 5 or 7 community members who can be champions for change. Train them on the community report card. For those of you who are writing your new implementation plans, this is something that we would like to have included in all the implementation plans, to identify a cohort of group of people who can be trained in the community report card, and then you're able to measure progress monthly for about 3 or 4 months. And then you can report back to us in this group and tell us, actually the community report card works, or the community report card is a completely useless thing. We should be able to throw it away. Good enough? I will send you, we have already shared this, so you have it. Yes, Wendy, go ahead.
No, I just had, there is something you said. You said that there is a consultant who will have a chance to talk and maybe revise on the household survey. The
tools, all tools, yes.
All. Because
all the tools.
we really had a big challenge when it came to secondary data on schools. Actually, whatever tool was sent to us, we were not able to fill it with whatever data we got from the government.
Yes.
For RIP, that is.
Okay.
So we just felt that for secondary data, and especially from schools, we didn't have much to fill on that tool. So if he's going to take us through all of them, I will really appreciate and have something to say about that.
Okay.
Thank you.
Yes, thank you very much. Yes, Mr. Singini is going to go through all the tools. We have tasked him, we have given him a very big task to go through all the baseline need data, analyze it, and bring out the issues, because even for us examining your baseline data, we see some of those gaps, or we see responses to questions that the question and the response don't quite match. And so he's going to be able to analyze all of that, give us the information. So we shall have a report on the baselines, but then we shall also have a questionnaire that is going to go out, or he's going to have meetings with you. We have not yet decided on that part, to have one-on-one meetings with you to be able to discuss these tools and see what are the challenges you're facing. Then he's going to revise all the tools so that by the time you need to do baselines, then you'll be using completely new tools or revised tools.
Okay.
Yes. So thank you very much, ladies and gentlemen. I'm going to end the meeting here. I want to thank you so much for participating in this. Once the recording is ready, then it will be sent to you. Kindly remember to fill out the post survey once that is also, the link is sent to you with the recording. Thank you and have a great evening.
Thank you
Thank you,
very
Dr.
much. Good
Karen.
night.
Bye. Bye.
Bye.
Thank you.